Dr. Richard Reish put a video out talking about how he handles patients coming that aren't happy and they're coming for a revision from some surgery that other doctors done. And he was talking about how he doesn't like to speak badly about other doctors. And this was reposted by Surgery 411 official, and it's a good topic for discussion. So there's both sides to the story I think need to be explained. I do a lot of revision surgery. When patients come from another office, it's not so important to talk badly, it's really not necessary to talk badly about wherever they came from. And believe me, sometimes they can deserve some bad talk. I mean, some doctors shouldn't be doing what they're doing. Sometimes they do something, just kind of leave it scratching and saying, what happened there? But that's not the time to really pile on whoever did the work before. What it is a time for is to hear the patient, understand their concerns, and see why they're upset. Someone coming for a revision always feels like something's been done wrong, and they're upset, sometimes frankly angry, and some of that is focused towards the last doctor that saw them. And sometimes they have a right to be, and there's a good reason to place blame in that direction. Not always. Regardless of where blame, if any, can be attributed, it doesn't really matter. It doesn't move the ball forward, right? When a patient comes for a revision, they just want to get to a better place, and that's our job as a surgeon. So the most important thing is to understand, why are you not happy? So have that conversation, hear what the real concerns are, what the issues are, and then try and move it forward. Now, the flip side to this, though, is that, and what I think Surgery 411 was latching on to, is that Dr. Reish wasn't really saying, I'm never going to speak badly about another doctor or say a doctor's done something wrong. It's saying, this is not the time to do it. When someone comes for a revision, you shouldn't be just spending time disparaging whoever did the work before. And unfortunately, we do see this in our business. It's almost like, well, I'm going to make myself bigger and I'm a better doctor because that guy was terrible and I'm much better and I'm going to do a much better job for you. You don't make yourself big by making other people small, and unfortunately, that's kind of the tact that some people take. It doesn't really fix things. But what Surgery 411 was concerned about was that the doctor was kind of defending, like almost blindly defending his colleagues. And I don't think that's what Dr. Reish was saying, because I think Dr. Reish would agree, and I certainly agree with Surgery 411, that is not appropriate. It's wrong. You should not just support something that was maybe done incorrectly, or a patient that wasn't treated well. And the most important thing is really hearing the patient there. The concern was, well, you're maybe writing off what the patient's saying and trying to defend your colleague and saying, oh no, that's not what happened here, this is okay. It's most important to listen, be receptive, be empathetic, and then do your best to try and find the best path forward. That's really what it's all about. Patients, when they're frustrated and they're angry and they're upset, and all these emotions are brewing around, they have this sense that they need to, they want to vent, and they want commiseration. They want you to get together with them and pile on that doctor and validate what they're saying and say, yeah, oh, it's terrible, it should never have been done that way. It's just important to keep your eyes on the horizon and figure out the best plan forward. Always great having conversations in the DMs and in the chat with Surgery 411. You should check it out. If you're just hearing this for the first time from me, check out Surgery 411 Official. Dr. Richard Reish, very good surgeon, very empathetic. So I hope that makes things a little more clear. That's my 2 cents. Thanks for watching.